So, who are the providers of weight management? Whoever is a registered dietitian, behavioral counselor, specialist, exercise specialist like gym trainers, etc. Physician as well, general physician as well. They all are the providers of weight loss strategies, and they can also treat obesity. Okay. So, coming to the strategies of weight management, we have the diet therapy. Okay. First and the foremost, we have to put the patient on a low calorie diet. In in severe cases of obesity, etc., if we put the patient on below the 800 kilocalories, okay, per day, 800 kilocalories diet, so it's a major behavioral change. Okay, definitely you will achieve weight loss. Definitely, initially you will achieve weight loss and rapid weight loss. Okay, if you go on a calorie deficient diet, definitely you will achieve a rapid weight loss, but the behavioral changes which should be inculcated in you, that won't be possible. Okay, that's only possible if you are on a very long term diet which becomes your lifestyle, which becomes your routine. So to lose weight and the maintenance of that lost weight, okay, that is possible. What the fat diets don't do is they will definitely give you instant results. Okay, sometimes even at the cost of your health, but making that your behavior, making a change in your eating patterns, in your behavioral eating patterns, that is not achieved by fat diet. Okay, so along with rapid weight loss, rapid weight gain can happen with crash diets. Okay, so very low calorie diet between 400 to 800 kilocalories can be used safely for extreme weight obese individuals. For extremely obese individuals, here we are talking about grade 3 individuals, and usually these extreme low calorie diet, you will be receiving parenteral nutrition, that is through your IV fluids, okay, IV sets, etc. You will be receiving your nutrition for extreme obese patients. Then reducing the diet, initially your portion size, okay, portion size has to be reduced. The first day, today is a day when you start to diet. Okay, just imagine from today onwards you're starting to diet. Okay, uh, till yesterday you were having around 3000 kilocalories per day. Today immediately you are going to jump to 800 kilocalories per day. Is it humanly possible to follow up that for the rest of few months? Is it humanly possible? It is not possible. Definitely one day you can fast, etc., but making that 800 kilocalorie diet a routine for you, jumping right from 3000 kilocalories to 800 kilocalories within a day, making that change is not possible until and unless you have met with a trauma or something which puts you on a bed rest or something like that. Okay, until and unless that things happen, you will not be able to sustain that. Okay, so taper your requirements slowly. If yesterday you had 3000 kilocalories, today try to have 2500. Next day put yourself to 2000 limit. So slowly within a week try to taper down your calorie intake till you meet your target calorie and maintain that pattern. That is possible. Okay, and also we will have one more operation or order of operation, that is energy deficient calculation. We'll do that later, the next slide. Okay, then we have physical activity. Just with diet you can lose a lot of weight, but adding a physical activity routine to your dieting, okay, that will accelerate your weight gain. Sorry, that will accelerate your weight loss. Okay, so diet alone, 80% of the results you will definitely get by your diet, but that additional 20%, if you add the factor of physical activity towards your dieting, it gets accelerated. The results get accelerated. Okay, and also the other risk factors that you had summed up till your obesity or overweight stage, okay, all those risk factors will also be recalculated once you put yourself on a physical activity stage. Okay, then stress management, a lot of obesity related issues are due to uh, environmental stressors, usually which is seen in urban population. It's not seen in rural areas, but in urban population, overeating, eating disorders, okay, behavioral patterns uh, that affect your eating modalities. Okay, these are seen in urban population. So stress management for those group of people is definitely necessary. We'll discuss about that also. Then pharmacotherapy, about this, if you are not a doctor, if you do not have the basic MBBS degree or pharma D degree, okay, there is a 6 years course in pharmacy as well that gives you doctorate. Okay, so until and unless you come under these two categories, no dietitian or nutritionist is supposed to prescribe any drugs here. Okay, there are certain drugs we have that we have named those drugs in the textbook as well. But if you are not a licensed practitioner, okay, you are not supposed to prescribe any of these drugs to your clients. Okay, even passing from this course, having a diploma level course as a dietitian doesn't give you the authority to prescribe these drugs. These drugs are highly addictive, as well as they uh, they are commonly misused or overused in the patients who have anorexia nervosa, etc. So using these drugs is a very tricky area. We'll list of the drug names later. Then behavioral therapy, as mentioned earlier, for obesity uh, related issues, lot of body confidence issues, okay, social anxiety, getting panic attacks when you are out, okay, not being confident, issues with your confidence level. These things will also emerge up. Even if you have lost a lot of weight, trying to unknot yourself from these mental health disorders is also another task. Okay, so we do have a need of counselors here as well. When somebody is put on an extreme weight loss or a complete transformation challenge, etc., okay, we do require a counselor as well, so that harmful practices are kept out of the way, okay, while they reach their goals. Then weight loss surgery, I'll show you the images of that. Uh, just the animated images of that you will understand what is this stomach bypass surgery that takes place when somebody is extremely obese. That's what we go for, these surgeries, which will take a portion of your stomach out, and it will tie up the remaining of your intestine with the fundus of the stomach. Okay, so the portion of the stomach is removed, and even after this surgery you can't maintain a normal diet. Okay, you will be put on a highly restrictive diet. Certain elements of the regular balanced diet will not be incorporated in your food pattern as well. Even the water that you drink, okay, how much of time gap should be kept before you drink the water and then you have food. Okay, it is not to be consumed together. So these all calculations are done post surgery. We'll discuss that also. So coming to diet therapy, so low calorie diet is prescribed here, less than 800 kilocalories only if you are extremely obese and you are taking this treatment, obesity treatment, under the guidance of a physician. Okay, in that case, extremely low calorie diet, which is less than 800 kilocalories, is prescribed. Again, repeating here, for extremely obese patient. For other healthy individuals who are slightly overweight, okay, or grade 1 obesity or slightly overweight, for that individuals we have a separate formula. We'll calculate that. You will get the idea. Okay, so keep a paper, pencil, as well as a calculator ready. It is coming up. Okay, next, coming to reducing the diet. So at least 10% of your body weight has to be reduced. That is the basic foundation of any weight loss plan. Okay, if this goal is achieved, your further weight loss can also be achieved. If you have to, reduced 10% in the initial few weeks of your body weight, immediately in initial few weeks, it may take 1 month or 1.5 months as well. Okay, it means that you can still move further. You can achieve further weight loss as well. So ideally, for per week, how much should be your weight loss? Any guesses? Per week, if you are on a weight loss journey, per week, how much should be your weight loss? Per week, it is 500 to 1 kg, maximum 1 kg. If you are losing more than 1 kg per week, you are doing something wrong. Your way is wrong. Okay. Minimum 500 kg you can lose per week on a weight loss challenge. Maximum is 1 kg. Don't go beyond 1 kg, otherwise it may come with some side effects. Okay. Usually at least 3 to 4 kgs will be lost in the first month. That is because of draining yourself out of your water weight as well. Okay. And your body is utilizing all the glycogen stores that it has stored up all these years. Okay. And within 1 month you will your weight, your fat from the adipose tissue will not start, it will not start burning up until and unless you have put yourself on physical activity pedestal. Okay. Until and unless you have done that, your fat from the adipose tissue will not start burning up in the first 1 month of any dieting. The weight loss which you have seen so far, it's because your body is giving up all the glycogen stores it had stored up. Okay. And that depletion of glycogen stores is what you see as a reflection in your lost weight. Okay. Mind you, you still have your fat stores as it is in the adipose cells. So that maintenance, the behavioral maintenance is required. Okay. Sometimes what happens, within 1 month you have lost 4 or 5 kg, you feel happy, now I can go back to my old patterns. You will leave your diet, you will go back to your old patterns. Remember that the fat stores have not been depleted yet, it is still there. Okay. That's how you will gain twice the amount of weight which you have lost. Okay. So that maintaining that behavior of putting yourself on a low calorie diet, complex carbohydrate diet. Okay. That is important, and putting that as your behavior, as your eating behavior, making that your eating behavior is important. Otherwise you will regain what all you have lost. So next, coming to this calculation, the equation which we use here is called Saint George and Mifflin. Saint George and Mifflin. I'll put the name of this equation in the chat box. Saint George and Mifflin equation. So here you will require your calculator, your paper, etc. I'll give you certain examples. Okay. I'll give you the body statistics you have to calculate. And while calculating, please make sure you follow the order of operation. What do you mean by the order of operation? People who are from the science background, what do you mean by the order of operations? What should be done first? If you have multiplication, division, subtraction, addition, everything given in a formula, what is the first thing you should do? Yeah. First, solve the things that are given inside a bracket. Whatever comes within a bracket, solve that. Then go for square root or cube root, squares, etc. Then division. Brackets, orders, then division, multiplication, addition, and finally subtraction. Because the answers which you will get is different just because you have not followed the BODMAS, that is the order of operation. Subtractions are done at the last. Okay. So there are two formulas. Okay. There are two formulas of calculating your energy requirement. Okay. That is calculating how many kilocalories you can have. Okay. So One formula is for males, other is for females. Those who have the textbook, open page number 302. Okay. Both the formulas are given at the top. Resting energy expenditure for males, resting energy expenditure for females. And there is a formula given on the slide here. Is it for the male or females here? So on the slide, it is given for females. Okay, what is the difference here? What's the difference in both these formulas? The male's formula and female's formula. What is the difference here? Yeah, in the female's formula, everything is same except you minus the number 161. For men, you add the number 5. That's the only difference. So you have to by heart this formula. It will be very efficient and easy for you to calculate your client's requirements, calorie requirements, specifically if they are on a weight loss journey. Okay, so I'll give you the metrics. So take a note of it. First, we can do the females metric. Then we will do another metric that is for males. Okay, so this is a female. Her weight is 75 kilograms and height is 165 centimeter. Age is 30 years. Sedentary lifestyle. Is the metric clear to everyone? Weight is 75. Gender is female. Weight is 75. Height is 165 centimeter. Age 30-year-old. Has a sedentary lifestyle. Sedentary lifestyle will come under which category in step 2? Decide that first. Don't forget to do the step 2. Most of you will forget to do the step 2. Sedentary lifestyle. What activity level will you choose from the given numbers here? Select the activity level 1.2 while using your formula. So first calculate BMR. What is the BMR you have calculated? First, just give me the answer of the first step. The answer for only step 1, should be 1470.25. The answer for only step 1 should be 1470.25. Have you all received that? Have you all got the same answer? Most of you have. Others who have not received the same answer, please check if you are following the order of operations correctly or not. Now going to step 2. What will you do here in step 2? The answer what you got in the BMR, basal metabolic rate, whatever answer you have got, that is 1470.25 is your basal metabolic rate for this woman. Okay. What is step 2? You multiply the activity level that your client has. So this client has a sedentary lifestyle. So you will use the number 1.2 multiplied by 1470.25. What is the answer? Yes, the step 2 answer is 1764.3. Now, here we are going to, what are we going for? Are we going for weight gain or weight loss? So the answer that you got after multiplying step 1 and step 2, you have to minus 500 kilocalories. Here on the screen you are seeing 300 to 500 kilocalories. Okay, but realistically speaking, if you want to reduce at least half kg, okay, half kg of weight per week, minus 500 kilocalories from the answer. For weight gain, we'll see later. Weight gain, there is a different topic. We'll see later. Subtract 500 from step 3. Yes, the answer is 1264.3 kilocalories. Has everyone got the same kilocalories? So this is the kilocalories you will suggest to your client who has these statistics. Okay, with different statistics of body, different metrics of body, measurements of body, answer will change. Okay, is it clear how you will calculate a healthy low calorie weight loss plan? Because see, 90% of the clients who will come to you will be with this rationale of weight loss. Okay, they just want to achieve weight loss or weight maintenance. And once they have achieved a specific amount of weight loss, do you have to change the metrics again, or do you have to follow the same calories? Let's say this woman was 75, okay? Within a month, she reached 70 kg. Will you change it, or will you still use the same kilocalories? You should change it, okay? Don't try to change don't try to change her calories every week. Don't do that, okay? Give at least 1 month time for the body to get used to that calorie, and then give the shock. If you give the body shock every 1 week or so with alternating calories, okay, it will not show you the desired effect. Okay, so at least for 1 month your client has to be on this 1200, just approximated to 1200 to 1300 kilocalories. After that, When you see the desired weight change, at least 4 or 5 kilos she has lost, then again you have to change your BMR calculation. 5 kg weight loss can happen if there is a water loss as well. Okay. If this diet is starting in the month of summer months, okay, you are putting her on this calorie deficient course, and on top of that you are adding physical activity with sweat and excessive urination, definitely 5 kilograms will be lost. Okay, we are not just losing the fat weight here, we are using the water weight as well. Okay. So this is how you calculate the calories for. So step by step here we have discussed. Now I'll give you the metrics for a man. Okay, gender is male here. I'll give you the metrics. You don't have to show me step 1, step 2, step 3 answer. Directly show me what calories you will guide here. Okay. See, Dr. Sonal Gade, till step 3, is it clear to you? Dr. Sonal Gade, till step 3, is it clear to you? Multiplying this answer and then activity level. So whatever answer you have got in step 3, you have to subtract 500, minus 500 from that answer. Why 500? Because we are aiming for at least 500 grams of weight loss, okay, per week. Is it clear now? So listen properly. I'll put the metrics in the chat box as well. So the gender is male. Weight is 95 kg. Height is 170 centimeter. Age is 30-year-old. Sedentary lifestyle. I have put the metrics in the chat box. Male, weight is 95, height is 170 centimeter, age 30, sedentary lifestyle. Don't give me the answers of step 1, step 2, step 3. Directly give me the final answer after subtracting 500 kilocalories. Directly give me the answer what you will get in step 4. And remember, the formula that you see on the slide is of a woman's formula. Don't use this formula for male. Male's formula is given in your textbook. I have mentioned the correct answer in the chat box. Please check that. Formula for male, everything remains the same from the BMR of a woman. Only the last part. In the woman, it is minus 161. For men, it is plus 5. That's it. There is no minus 161 in a male's formula. For a male's formula, after 5 into age in years, bracket, plus 5. Is it clear? Did everyone else got the same answer? 1741 kilocalories. So this is how you use this formula. Also, for a woman's chart, we got around 1200 something calories, approximately 1200 or 1300. So if you require a diet plan for that, WhatsApp me right now. I'll forward you the image of a Indian diet plan which you can use for a female. It has options for vegetarians as well as non-vegetarians. WhatsApp me right now so that you won't forget later at the end of the class. I have a diet plan of 1200 and something kilocalories. I'll forward you that. Next, a diet plan is given in your textbook, page number 538 and 539. Page number 538 and 539. Please open that. What is calories? What is kilocalories? We'll study in the chapter on energy balance. There is a chapter called energy balance. When that chapter will come, you will understand what is energy and kilocalories, etc. There's a specific definition to calorie. Okay, we'll teach that later. So what do you see on page number 538 and 539? Please reply in the chat box. What do you see on page number 538 and 539? It's a sample menu plan. It's a dummy menu plan for an adult man with moderate intensity workout. What is the calories given here? What is the calorie given? Read above, below, top of the table, footnotes of the table. It's almost 2,700 kilocalories. One diet plan is 2,734. The another one, non-vegetarian one, is 2,731. Almost 2,700. Okay. So you can tweak this diet plan as well. Add some, if you want to achieve weight gain, or based on your client statistics, it is around 3,000 kilocalories. You can add more. Okay. You can subtract some portion size as well from this diet plan. Okay. You can make your own. You can play around with it. Okay. Based on whatever diet plans you, whatever creativity or whatever subjectively your client wants, dislikes certain food, likes certain food. Okay. Based on that, you can tweak it around a bit. Okay. If you want protein exchange, what will you do? Which chapter will you refer for protein exchange? For example, here groundnuts are given, milk is given, idlis or something is given, idli, etc. is given. Which chapter you will use? to understand what other options I can give. If I don't want to give idli to the patient, to this client, the client doesn't want idli today, we'll go for upma, we will go for dosa. But how much? How much of idli, upma or dosa should I provide to which gives the same protein? Yes, you will go to the menu planning chapter. There is a food exchange list in menu planning chapter at the end of the chapter. Refer that list. Okay. How to use that list, menu planning, when we will discuss on menu planning, we'll come to that. Okay. For new batch students, for students who are new, who are sitting here for the first time, now the revision classes are going on for previous batch students. So students who are new, exclusively new classes will start after 5th March. Okay, so you will understand, you will have a deeper understanding on how to use these different chapters to make a creative diet plan of your own. Okay. So these topics will be a revision for you later when we will take a repeated class as well. So is it clear so far how to calculate your weight loss calories? You can do this for your family members as well. You can use this formula, these techniques on yourself if you are achieving for a weight loss plan as well. Okay. Use the dummy plans which is provided in the textbook. See the appendix, what all things are there in the appendix of the textbook. Go to menu planning chapter. Menu planning chapter will be very important for you from a practical point of view. Okay. Next, coming to the principles of weight loss. Okay. 20 kilocalories per kg body weight. So just for example, if I wake you up in your sleep and I'll ask you St. George and Mifflin's formula, will everyone be able to answer it? Even if you practice it today, tomorrow, after a month, definitely you will forget it. Okay. So what is the other way which you can make sure that if somebody knows you are a nutrition or dietitian, okay, they meet you in your street, you're going somewhere, meet you in the airport or somewhere, okay, they'll ask you what calories should I follow, I want to achieve weight loss. This is what you tell them. Use 20 kilocalories per kg of your body weight. For example, here gender doesn't apply. Okay, male, female, trans, whatever, the you can give the same guideline here. So just imagine a person is 62 kilocalories. They want to achieve weight loss. Okay, what is the what calorie you will suggest here based on this particular guideline? 62 kg person. Female, male, doesn't matter. Yes, 1240 kilocalories. If you convert that, you make it in an approximate number. You tell them, please don't go beyond 1300. Maintain your daily calorie requirement between 1200 to 1300. Give them that range. Okay. When you give them the range, small treats, small sweets, okay, small indulgences, okay, they can include that also. They will not get tired of the diet plan. Okay, so we give them a range. Okay. And what is the protein requirement? 0.8 to 1 gram of protein per kg body weight. So even if the person is sedentary, it is ideal to suggest them at least 1 gram of protein per kg body weight. Whatever is their body weight, 65 kilo person, 65 gram should be your protein intake daily. Okay, 75 kilo person, 75 should be your protein intake daily. Okay, it's better to keep protein intake a little bit higher because it will satiate them. Protein rich food will give you the satiety. You will not feel hungry a lot of times. You will not be munching along. Okay, go for complex carb food. Give me some examples of complex carb food. Previous batch students, new students can refer these information for later as well. Complex carb. Complex carb foods are naturally low in their glycemic index. They will, what is glycemic index? It's the rate, it's a rank with which a food is able to spike up your blood glucose level. How soon a food can spike up your blood glucose level or how slowly it is going to spike up your blood glucose level. That information you get from glycemic index of foods. Okay. Yeah, brown rice, oats, all your millets, ragi, bajra, jowar, unpolished rice, sprouts, vegetables, okay, vegetables with their peel, okay, they are complex carbohydrates, avocados, root vegetables, they are starchy, they can spike up your carbohydrate, especially sweet potato, etc. Sweet potato, tapioca, okay, potatoes, they can spike up your blood sugar level quickly, so they won't come under low glycemic food. They could have fiber based on the complex carb, but they are not low glycemic. Okay. So go for skimmed milk. Okay. Don't go for whole milk. Go for skimmed milk. Don't use full fat milk. Make sure you do not have any trans or saturated fatty acid rich food. That is, don't go for any food that is packaged. Fries, chips, pastries, baked items, cookies, biscuits, sweet treats, okay, mithais, etc. Avoid that. Those have high amount of trans fat and saturated fats. Vitamin A and D supplementation. D supplementation will be required because could you just give me a reason why the person here may require vitamin D supplementation? Yeah, so that there is no calcium loss in the body, but as well, you are putting the person in a very low calorie diet. Okay, low calorie diet. Naturally, all the fatty food, all the fatty food is avoided. Like the even if the person is going to have meat, okay, even if the person is going to have meat, they will have to avoid the bone and the skin part of the meats. They have to just go for chicken breast, chicken thighs, okay. The boneless pieces they have to indulge in for the protein requirement. And the boneless pieces of the meat, they do not have fat content. If they do not have the fat content, vitamin D is poor, okay. So, so that the person does not go into a deficiency of vitamin D, which will lead to other disorders as well, like osteoporosis, low calcium levels. Okay, to avoid that, we give vitamin D supplementation. Why we give vitamin A? To prevent blindness, to prevent night blindness, eye-related issues. Okay, to make sure that their eyesight is proper. Vitamin A is required. Also, vitamin A is a very good antioxidant as well. Limit the dairy intake to limit the calcium. Why we are limiting the calcium here? Sometimes with obesity, okay, with obesity, that when there is too much of calcium overload, your bone weight itself is harmful for your femur bone, your thighs, your knees, and the joints. Okay, so if you are able to take away a lot of this won't apply for everyone. Limiting the calcium does not apply for everyone, only in severe grade of obesity because of overindulgence, okay, hypercalcemia, etc. In such cases, we have to limit the calcium intake, okay, not applied for everyone. A dietitian can prescribe certain well-known supplements, okay, which is well searched, but doing the well research is the dietitian's job here. You have to refer to true articles, not the ones that is not the research that is conducted by the pharmaceutical companies. Don't go by that research. Do not ever follow the results of the research that is published by any pharmacological company, okay. That could be highly biased because they may have to sell their product, okay. Go for the research that is published by the government websites, okay. In India, we have the NICB website, NIN website, ICMR website, okay. You can also refer to World Health Organization website, CDC websites, okay. FAO, Food and Agricultural Organization, which is a US based website. In India, you can also refer FSSAI websites, okay. These are the well-known websites which will give you true information without any bias, okay. Don't go for pharmacological or private websites that is pushing to sell their products, okay. They have a very highly biased results in their research, okay. Yeah, you can use protein bars. Protein bars should be a secondary option. First, try to make sure how much of protein can you get from your real food, okay. If you have a very busy lifestyle, you do not make time to cook these foods, you are in an office space or somewhere where at this juncture of time you are not able to access the protein from a meal. In that case, you can go for protein bars as well. But whenever you're going for protein bars, make sure you check the ingredients. The protein bars, the energy bars which you indulge in, should have zero trans fat. Okay, should have zero trans fat. Buy protein bars which have zero to no trans fat. WhatsApp me to get the list of the websites, recognized websites. Okay, a glass of warm water before meal is ideal. Okay, it what does it do? A glass of warm water at least 15 to 20 minutes before your meals, what will it do? Yes, it stimulates the digestive enzymes. It stimulates the peristalsis movement. Peristalsis. Peristalsis movement, I have mentioned in the chat box, the spelling of it. Okay. Please do a Google search on this. You will understand. It's the movement, it's a wave-like movement of your entire GI tract. Starts with your mouth, starts with the top of your esophagus, your mouth, ends at your anus, from where you defecate. Okay. So the one wave of the peristalsis will start from as soon as you swallow. It will end after digestion. That wave will end with the defecation of your feces. Okay, that's the peristalsis movement. So when you have warm water before meal, you have started off, you have kick-started your peristalsis movement, which will keep going. Okay, which will, that movement will ensure that your intestines are ready to receive the food. Okay, keep the movement going, because when the peristalsis movement is ongoing and you're having food filling up your tummy, okay, immediately you can expect immediate release from the tummy, release of food from the tummy into the intestine, and the digestion, as soon as the food reaches your stomach, within an hour or so your digestion of that food will also start, which makes sure that you have a good metabolism. That's the use of having warm water before meals. Okay, and also there are lots of rumors going around of having apple cider vinegar early in the morning with lukewarm water, having lemon with lukewarm water. These things are not well researched. Okay, these things are not well researched. If you want to have some lukewarm water in the morning, have it as it is. If you are diabetic or so, you can have methi seeds in that water. If you have cardiovascular disorder, you can have garlic infused water, because researchers have shown these methi seeds, fenugreek seeds will reduce your glycemic index. We have proof about it. We have seen garlic reducing the cholesterol level, serum cholesterol level. Okay, but it just a little bit effect, not drastic reduction. For drastic reduction, you require pharmacological medications. Okay, but having apple cider vinegar, having lemon early in the morning in empty stomach with lukewarm water, these things are not well researched. Okay, and to a certain extent, these highly acidic items are not even well tolerated by your stomach. You are adding something hot and something acidic in your empty stomach. People who are from the medical background, what are the repercussions that can happen in the future? You can put in the chat box. Apple cider vinegar is acidic, lemon is acidic, hot water, the temperature is high. Over a period of time, what can happen? You're subjecting your stomach to peptic ulcers. Peptic ulcers, gastric ulcers. Okay. So just have lukewarm water. That will make sure that you can empty your bowel. Your bowel movements are emptied early in the morning. Okay. Just go for simple lukewarm water. That will do the same. That will give you the same benefit. Okay. Yeah, gastric regurgitation will also happen. Then high fiber diet. High fiber diet to keep the gastric motility on, so that you don't suffer from constipation, your metabolism is high. Okay. So pharmacological drugs, these are the drugs, yeah, erosions of gums as well, and even your enamel. When you have something too acidic early in the morning, you are projecting your enamel of your teeth to future corrosions. Okay. So if you have that habit of having apple cider vinegar, lemon, avoid that. Okay. Switch to just lukewarm water. So pharmaceutical drugs, sibutramine and orlistat. Sibutramine and orlistat. These are the pharmacological prescriptions given for weight loss. Should not be prescribed by a dietitian or nutritionist. Avoid prescribing these drugs. These are taken only after proper consideration by a GP, general physician, family doctor, okay, or a weight loss specialist. So are the principles clear to all? Next, coming to the surgery. This is your gastric bypass surgery. Sibutramine and orlistat. This video will be uploaded later in the website, in the YouTube channel. You can check that as well. Okay. So gastric bypass surgery, this is how a normal stomach, duodenum and jejunum, okay, will look like. So what you are doing here in a gastric bypass surgery, you are taking away the part of the stomach here, okay, bypassed portion, and you suture up the jejunum, this part. This is sutured up to the end of the esophagus. Some part of the stomach's fundus. Fundus is this upper area. Okay, this upper area of the stomach is what we call as the fundus of the stomach. Some part of it is retained. Some part of the fundus of the stomach is retained, and that is sutured up. Okay, with the jejunum. So now the food will directly go into the jejunum. It will not sit in the stomach. Okay, there is no chance of your food getting mixed with gastric juices. Okay, so this is how the gastric bypass surgery is done. For morbidly obese patients only, this is suggested, otherwise no. The other name for gastric bypass surgery is bariatric surgery. I'll describe the spelling in the chat box. So people who have a body mass index above 40, only for them we would suggest this. Okay. Yeah, it may cause a lot of issues, because if they do not follow their diet after this, all the food will not be suggested. Whatever they were supposed to eat, they were eating before the surgery, they have to completely avoid it. They have to go for some supplements, some solutions, some pre-mixed nutrition. Okay, these kind of food is what they will eat. Okay, juices, thick gruels. Okay, these kind of food is what they will be put on rest of their life, because gastric juices are now not available. Okay, gastric juices, the pH of your stomach, your hydrochloric acid, these things are not available. Okay, so such consideration has to reflect in the choices of your food as well. Okay, if you require the list of guidelines one has to follow post bariatric surgery, just WhatsApp me. I'll share you the link. You can refer that as well. So the weight loss here will be very dramatic, because within a week, okay, that one entire week will be post surgery era. Okay, post surgery, the patient will be still admitted in the hospital. Patient will be put under IV fluids, NG tube, etc. Okay, parenteral nutrition is going on. But what happens after the patient leaves the hospital and goes back home? The patient is not eating the food that he or she was supposed to eat before surgery. Okay, now the diet has completely altered. The patient will invest in buying these ready-made food supplements for post-bariatric surgery patients. Okay, so dramatic weight loss you will see in these patients. And also with dramatic weight loss, what will be the physical effect on the patients? How will they look? How will their skin look? How will their muscles look? Does anyone have any idea? The muscles will not have any tone. It will sag. Okay, it will be completely loose. Okay, it will be hanging off the body. It will not be on the body. The skin, the muscles, everything will be hanging off the body. You can imagine that situation. So after bariatric surgery, the cosmetic procedure will not end here. Okay, after bariatric surgery, the cosmetic procedures will start even more. There are various cosmetic procedures which is used to suture up your sagging skin. Okay, a lot of ultrasound and laser rays are also used to tone up your skin. Okay, it's all expensive. It comes with a lot of cost. Okay, most of it are not even covered under insurance. So yeah, because the skin was completely distended before surgery, and immediately when there is a dramatic weight loss, all the glycogen stores have been used up by the skin, and what remains is a sagging loose muscle. Okay, and post this surgery also, the patient will not be put on cardio exercises or any intense exercises. They have to recover first. Internally they have to recover first. Okay, so with obesity, morbid obesity, a lot of health issues like sleep apnea, not able to sleep, not able to breathe while sleeping, okay, hypoventilations, these kind of symptoms, when it is persistent, it is life threatening to the patient. That's when we go for gastric bypass surgery. So why do we remove the stomach here? Because the stomach lining, it produces this hormone called ghrelin. I'll put the spelling in the chat box. What does it do? What does the ghrelin hormone do? Any idea? Ghrelin hormone. Yet it signals hunger. It increases appetite. So the ghrelin secreting glands are present in the fundus area of the stomach. So when you completely remove this fundus area of the stomach, your body will no longer produce ghrelin. The body will no longer produce ghrelin. When the body doesn't produce ghrelin, you will not feel hungry. You will not feel hungry. Okay, your appetite automatically comes down, and also the capacity of your stomach is also very less. So it works both the way. Okay, so that's the rationale behind doing the gastric bypass surgery. Is it clear to all? What is gastric bypass surgery? How does it work? How does it function? The patient will be put on lifelong oral supplements. Okay, the patient will be put on lifelong oral supplements. There are certain supplements that will counteract the ghrelin hormone. Okay, pharmaceutical supplements like the ones we have discussed earlier, sibutramine and orlistat, etc. They play a role in suppressing the ghrelin hormone, release of ghrelin hormone. So these drugs are abused by the people who work in entertainment industry. Okay, so that's the reason why we can't allow anyone else to prescribe the drugs. Models, actors, actresses, okay, they do tend to abuse this drug so that they achieve rapid fat loss, unhealthy fat loss. So it's not given over the counter as well. What are the complications of the surgery? Physical activity, okay, since the like your knees, hips, etc. was carrying all the load all these years, okay, and once it is immediately off your system, your body goes into a shock. Okay, you can't be as physically active as compared to your peers in this case, in this surgical case. Metabolic disorders like Alzheimer's, diabetes, immune dysfunction, CVD. Okay, these all things can be seen. Cardiovascular diseases, people who have high BMI, more than 30, they tend to develop high blood pressure. Okay, increased incidence of varicose veins, etc. It's seen. Sleep apnea, transitional cessation of breathing, that is while sleeping, because of the weight of their body, the body presses against the diaphragm. Okay, and diaphragm again will press your lungs upwards. So your lungs is not able to distend completely with oxygen, with oxygenated air. That leads to sleep apnea as well. Obese people are prone more to accidents by falling down on a slippery floor, etc. Even if they try to catch on a side rail or something, because of the weight of their body, their hands may not able to take the load of the entire weight while they're slipping down or falling down. Okay, so they're prone to accidents more. Then GI disturbances like gastroesophageal reflux disease, that is GERD. Okay, when you have a very distended stomach, okay, over a period of time you eat so full that some part of your hydrochloric acid that is secreted in your stomach along with the enzymes and food will go back into your esophagus. Okay, the food is so full, you have ate so much, your stomach is so distended that there is no space left, and that the food tries to come out back through your esophagus. So that leads to GERD, that is gastroesophageal reflux, refluxing back into the esophagus. And again, recurrent occurrence of these refluxes will lead to inflammation in the esophagus, esophagitis, ulcers as well. Then we have osteoarthritis because of the weight bearing bones like your knees, femur, ankles. Okay, with obesity, a whole lot of load is put on your knees and ankles. So because of the overload of weight, you may tend to have arthritis sooner. Then obstetric risk, all the pregnant women who have a body mass index greater than 28, okay, they tend to have a complicated pregnancy. It could be GED, that is gestational diabetes, or PIH, pregnancy induced hypertension. Okay, these kind of complications are very common in obese pregnant women as compared to the leaner ones. And also going under C-section is highly prevalent in obese women as compared to the leaner ones. And psychological disturbances, self-blame, social anxiety, panic attack, so isolating one from others, not participating in group activities, confidence issues. Okay, these things will also tend to boil up. Low life expectancy because there is underlying risk of a vast majority of lifestyle diseases like cardiac diseases, diabetes, kidney failure. Okay, there is a looming gloom of all these non-communicable lifestyle diseases upon the people who are obese. Definitely their life expectancy will come down. Coming to cancer, specifically colon cancer, rectal cancer, prostate cancer in men, uterus in females, breast cancers in females, ovarian cancers are prevalent in obese patients as compared to the leaner ones. So as a dietitian, what you have to do for weight management, first you have to determine what all indices you have to determine. You have to see their BMI. Okay, even though BMI has certain limitations, doesn't mean that you do not have to calculate it. Whatever clients you see, you calculate their BMI. Okay, check their waist circumference. Take a measuring tape with you. Check their waist circumference. What is the size of their waist in inches or centimeters? Okay. BMI related health risk. Do they have diabetes? Do they have cardiovascular issues before? Okay. What is their attitude? Are they happy with their body? You will see people who are body confident, even if they're obese, even if they're overweight, they don't mind it. They are completely body confident about themselves. Sometimes there are people who will show the fake confidence as well. So you have to identify, okay, what is their attitude with their body. Sometimes people who have these social anxiety issues, isolation issues, they tend to do self mutilation, self harm. When you do a physical assessment on them, you will find bruises on their body parts, okay, cut marks on their body parts, which shows that they are not in an aligned, healthy relation with their body. Okay, so that's their body's attitude. Eating style, are they an emotional eater or not? Okay, you can ask them the simple question: when you were a student, when the exams came, did the exams affect your appetite, or did the exams have no effect? Okay, did you eat a lot during your exams, during the days of your exams, or did you eat less? Okay, based on the answer, you can understand, okay, are they an emotional eater or not? Okay, people who are emotional eaters, they will tend to say, yeah, they used to put on a lot of weight under stressful situations. Okay, food choice skills, what kind of like, are they naturally drawn to junk food, healthy food? Physical activity, do they have any? What is the weight management history? Some people have a history of fluctuating weight. Okay, every year they may lose or gain around 5 to 6 kgs, and it goes on like that. It's difficult for them to maintain a proper weight. Okay, within 2 months or 3 months, they may gain, they may lose. Okay, it goes like a it goes high and low throughout the year. That is their weight management history. Weight expectations, do they have high expectations, or do they have subnormal expectations? Okay, support system, are they being abused, getting abused by their colleagues, their peers, or at home? Sometimes the body issue that a person may face actually happened because how their family treated them. Okay, since they were a child, even if the child is slightly overweight, parents themselves use annoying words, annoying slangs against their child, may also affect their mental health. So see what support system they have at home, at workplace, or at place of education. Then decide, do your client, does your client requires a short term goal or a long term goal? People who have morbid obesity, they will require a long term goal. People who are overweight, slightly overweight, trying to just maintain a weight management lifestyle, for them you can just plan a short term goal. Then apply what kind of food choices you can apply here. Low energy dense food, that is, which gives low energy but they look bulky. For example, salads. Okay, whatever salad you choose, a bowl of salad looks bulky. Okay, you see a lot of variety in your salad bowl, but the calories that a salad bowl will give you is very less. That is low calorie dense food. Whole grains, fruits and vegetables, okay, these things you have to focus more. Practice internal regulation. Okay, hunger cognition, eat only when you are hungry. Okay, understand when to stop. Enjoy physical activity. Don't put a same weight loss trick for everyone. Some people enjoy doing yoga, some enjoy doing cardio workouts, some like to do pilates. Okay, some just like to do brisk walking for an hour or two. Everyone has their way, so put them in a way, in a physical activity which they actually enjoy. Okay, something that has worked for you may work from others as well. It may work for others as well, but will they enjoy doing it? That's the question. Then monitor food records. Make sure that your client is maintaining a food diary. Okay, with food diary, it becomes very easy to understand and maintain a healthy diet, because once you start putting down everything that you have eaten throughout a day, it is a self reflection for the client as well. Okay, sometimes we think that we eat very less, but as soon as we start adding on everything that we have munched throughout the day, that's a self reflection. Okay, so they will be, at the end of the day, they will be like, oh my god, I had so much of food, and here I was thinking I don't eat much. Okay, when people say I don't eat much, they generally tend to derive from the fact that the main meals that they have, that is breakfast, lunch, or dinner, is portion controlled, but they tend to forget what all things in between they had, what all treats, over indulgences they had in between the main meals of the day. Okay, so monitor that, track, keep a food diary, monitor it.